Once again, welcome to another exciting episode of Healthcare Today with the HSA. I'm your host, Chuck Taylor. And each and every time we get together, I want to thank you for tuning in to Bobo 89.1 FM. This time we're talking about World Premature Awareness Month and also World Prematurity Awareness Day. Now, I have with me one of our, is it neonatal nurse? Neonatal nurse, Miss Angella with us. She's going to be basically telling us a little bit about the process and understanding what prematurity is, and also helping us understand the Awareness Month and also Awareness Day, because this is celebrated worldwide, isn't it, Miss Angella?
Hi, good afternoon, and thank you for having me. Yes, the World Prematurity Awareness Month is a global recognition of premature birth and sometimes the devastating effects having a premature baby can have on the entire family itself. Mm-hmm. So it is a global awareness month. And
we try to have an open conversation about it. So I hope anyone listening here understand it's a couple of technical terms that we need to. A normal pregnancy is about how many weeks?
Normal pregnancy is 40 weeks. So when we say premature, prem means before. Mm-hmm. So it would be a baby that is born before they get to the 40-week gestation.
Okay.
So any baby born before 37 weeks or your 8.5 months roughly would be considered to be premature.
Okay.
But we do have subcategories of premature, how we categorize them. So you can have your extremely preterm, and those are the ones that are born from 24 weeks to 28 weeks.
Wow, that's really early.
Really early. And then we have our very preterm, mm-hmm. who are from 28 weeks to 32 weeks, and our moderate to late preterm from 32 to 37 weeks.
Okay.
We take 24 weeks. So the full pregnancy is 40 weeks, but we take from 24 weeks because developmentally, how a baby is developed, 24 weeks is the age roughly where we can say this baby can survive outside the uterus.
Okay.
Obviously, given that we have to use ventilators, support,
right.
Medications.
There is
support 24 weeks.
Uh-huh.
Less than that, maybe not so much. You may have a few 23-weekers who do make it, but they do make it with a lot of comorbidity problems. Because there are lots of stuff that can happen to a preterm baby.
Right. And that's one of the things, being that we're talking about it, this month, the month of November, is World Prematurity Awareness Month, and World Prematurity Awareness Day specifically is on November 17th. So that's just coming up in a few weeks, folks. And, we want to raise awareness for it because, this is something that we talk about it for a woman. On a woman's side, it's devastating, but also from a family side, the toll that this takes on a family with resources, stress levels, things like that is enormous, isn't it?
It is enormous. Because you're pregnant and you're expecting to go the full hog 40 mm-hmm. weeks, and then suddenly you're in labor 25, 28 weeks. Oftentimes, most of the times, parents aren't ready.
Right.
Not ready, mentally not right. ready, physically not ready, mm-hmm. home-wise not ready, because, sometimes you have other children in the family and they have their set routines.
Right.
You have the drop off to school, the pick up from school, the extracurricular activities, all those things that you do on a regular basis. So when a baby comes early that is not well planned, that can throw off your family routine.
Right. And this can be for numerous factors. It could be medically wise. It could be stress related. It could be numerous factors why. And is it okay to use the term preemie? Because I keep hearing preemie. Yeah, I hear that a lot. From expecting mothers that they hope the baby isn't a preemie. They want to go to the full term. So we'll use that term. And what's some of the challenges that babies may have if they're born prematurely?
So as we said earlier about the different stages of a preterm baby, some of the challenges the challenges vary according to how old your baby is. So a baby born 24 to 28 weeks will have more challenges than, say, a baby born at 32 to 37 weeks. So the earlier the baby is born, the more challenges that baby's going to have. So some of the common challenges that we have or we see is, one, people will hear about PDA, a patent ductus arteriosus, or people say a hole in the heart. That's one of the common challenges of a preterm baby. And it's just an abnormal flow of blood, of how the blood flows within the heart. And that sometimes requires surgical intervention to be corrected.
At a baby level, at a baby stage? Wow. At
a baby stage. Often not immediately at birth, but as closer as they get to being term, then we get that corrected before they actually discharge home. Plus, there is the added factor of retinopathy of prematurity, which can lead to blindness. It's the fragile vessels in the eyes. If they break, yes. And we have to use oxygen on these babies to support their respiratory system. So that affects these vessels, and then they can go blind. However, there's technology. So you can give them laser treatment on the eyes if it's detected early. And, later on they can have corrective glasses. So you can see little kids running around with these very thick bifocals. You can tell some of them were preemies. There's also gut problems whereby the intestines develop an infection called necrotizing enterocolitis, which is higher in preterm babies. And then that puts the babies back with feeding challenges. Sometimes that does require surgical intervention again, which may lose some of their intestines. And these feeding challenges are long-term. So there's a lot of things that can happen to your preterm baby.
It's really varied. As a listening mother, someone's listening there, how can you help your baby to reach term? What eating properly? Because what you just said is a lot to take in for any expecting mother. You've had several. It doesn't matter. This is a human being that we're talking about here, and it's your child. So how can we kind of help mothers do don't want to say the right thing, but just do the correct thing to help get to term? How can we do that?
The best thing mothers can do is, once you are planning your pregnancy or once you've discovered that you're actually pregnant, is to ensure you get proper antenatal care while you're pregnant. That is the best thing you could ever do. So once you're pregnant, go see your healthcare provider or your midwife, and they will guide you. They'll tell you about your nutrition. They'll do regular checks on you and on the baby as well to see how baby is developing. And sometimes medical conditions that mom may have, but were under control, those can get a little bit out of hand during the hormonal changes of pregnancy. And there are some that mom never had, but in this pregnancy it comes to the front, like hypertension. And most times premature babies are delivered prematurely because mom developed hypertension in pregnancy. And she was never hypertensive.
I didn't realize that.
Yes.
That's a huge factor.
Yes, that's a very huge factor in Black women. Hypertension in pregnancy. So once you're seeing your healthcare provider, they are able to give you the correct medications, monitor you closely during your antenatal care, which will help.
Regular checkups are
checkups are a must.
Definitely. And folks, we're talking here today. Welcome to the show about World Prematurity Awareness Month and also World Prematurity Awareness Day, which just happens to be on November 17th. All of this month, we're going to be talking about issues related to babies, health issues. I mean, one of the things I saw that, popped up, you were talking about hearing and vision problems. I didn't think of that per se. I think of cerebral palsy and learning disabilities and poor growth, underdeveloped child. But there are other neurological problems that go along with this.
Because when you were born premature, the body develops in stages. So each, say every month, your baby matures more and more and more while the baby's on the inside. So obviously when the baby comes out, whatever month it comes out or whatever week it comes out, something just didn't get properly formed.
Yeah, developed.
Right. So say your baby's out at 29, 30 weeks or a little bit less. The brain, the vessels in the brain are still super, super fragile. And sometimes they develop a bleed on the brain, just like an adult having a stroke. They develop a bleed, and depending on what area on the brain or the size of that bleed, then that baby growing up will have developmental challenges. So they may have the need to use a wheelchair and or speech problems, walking problems, as we did say with the eyes, vision problems.
Vision and hearing.
But you wouldn't really know until your child is not achieving those developmental milestones.
Okay.
We can predict, the doctors can predict based
Certain
on
things.
what but you wouldn't, they can only tell you from what we've seen before, a child with this size bleed on the brain will have this challenge, that challenge.
Right.
So they can predict a little, but
based on the knowledge base that you've seen in the past, you have this kind of understanding. But physically, you're able to see things like the hole in the heart and things of that nature earlier. But the learning disabilities and vision and hearing problems, you won't see that until the child begins to grow.
Actually, for vision and hearing, we have diagnostic tests that we do. Here at HSA, all our babies who are born at HSA do get a hearing check before they go home.
Okay.
All babies routine, whether or not they're preterm or whether or not they're term, they are routinely screened for their hearing.
Okay.
So that's a part of the service that we do. So we do know. So if they have repeatedly been referred, we don't like to use the word fail because sometimes, it might not be a fail, something else.
Right.
So once on our system, when we are doing the hearing tests, we see it being referred. We then send them out, for a more in-depth hearing assessment before we make a decision to say, oh, your child is deaf.
Okay.
But it does give us some predictor, and it does let the parents know that actually we've done the hearing. With the visions, our babies who are born less than 30 weeks, so 30 weeks and less, we do have them screened to check their vision as well on a weekly basis.
So just that 10 weeks makes that
it makes a huge difference. So a baby born at 28 weeks and a baby born at 30 weeks, it's a huge difference. It's a huge difference in the amount of respiratory support sometimes that this baby needs and the other challenges that comes with it.
Wow. Okay.
So, sometimes if you know a woman who is a potential candidate for a preterm baby, you can say to her, please, 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 hang on until you get to 30 weeks. Hang on until you get to 32 weeks. Because every week counts.
You often hear, they say, keep her calm, keep her, check her blood pressure. You hear that a lot. And I kind of go back to our living in the Caribbean. We have a lot of stressful that other communities in the world do not have. And whether it's weather related, different things, and we're not talking about that specifically, but stresses on the mother varies. And I always remember growing up, they always said, she's getting close to term. Try to keep her calm. Remove her out of whatever situation she's stressful. Maybe the job, maybe the home life. Whatever it was, remove her from that. Keep her calm because the baby is at risk.
At risk. But remember, pregnancy itself is stressful in itself. You may not have any other issues, but the pregnancy itself is stressful because there are psychological changes, physiological changes that go on with mom, hormones-wise. So that in itself is a stress. So having that as a stress, you try to reduce the other stresses around. So, job stress, Some of it we can't escape, but
Right.
if we can, you
Reduce
always
it
try and reduce it as much.
Exactly.
And again, family support is very, very important. Having a good supportive system is really, really helpful to pregnant mothers. And, I know for us here on Cayman, a lot of persons here are just here sort of like isolated from their families because they're here for whether it be work reasons or so on. So you don't have, that extended support you would have had if you were in your home country per se. But still having a support system here, whether it be through friends or work colleagues, it can help, and it does make a huge difference.
Excellent. Once again, we're talking to Nurse Angela. She's a neonatal nurse over at the HSA. My name's Chuck Taylor. We'll be back in just a few. We're talking about World Prematurity Awareness Month, which happens to be the month of November, and World Prematurity Awareness Day, which is happening on November 17th. We'll be back in a few minutes. Keep it right here to Bobo 89.1 FM.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
Folks, thank you for tuning in. It's Healthcare Today with the HSA. I'm your host, Chuck Taylor. And each and every Friday and Saturday, we get together and have this conversation, a very honest and frank conversation about issues that matter to you and also things that bring awareness to your health and the well-being right here in the Cayman Islands. So this month, we're talking about World Prematurity Awareness Month, which happens to be the month of November, and World Prematurity Awareness Day, which is November 17th. I'm talking with neonatal nurse, Miss Angela. She's here with us, basically telling us about how the days came about and just getting you more concerned on how to basically escape the idea of prematurity. Now, and I say escape because we try to do our best to avoid the situation. And how significant is this problem in Cayman, Miss Angela?
So I am relatively new to Cayman. So I looked back on our admission statistics back to 2017. So I looked on all the babies that were premature and admitted to the unit. And from then, there was an average of 60 to 65 babies per year being admitted for prematurity to our NICU. Fortunately for us, most of those babies are in the 32 to 37 week range. Okay. So it's not too bad.
It's the later
preterm
stage.
Yes. However, we do have some that are born less than 32 weeks. So ideally, all babies less than 36 weeks are admitted to the NICU. Those babies born less than 28 weeks are predominantly the ones that we would refer overseas for additional care, because they would need longer term intensive care support. And oftentimes, as I talked about, some may need surgery later on and so on and so forth, which we do not provide here on Cayman. So we rather send them on earlier so they can get the treatment they need overseas.
Right. The earlier you approach it, the better results are able.
So 30 to 37 weeks are our ones that the more ones we see here in Cayman, and those are the ones who will definitely stay with us unless they become severely unwell.
Okay.
Younger than that, we send them overseas.
I was looking online trying to get some information here. And according to the World Health Organization, WHO, 1 in 10 births.
1 in 10.
What? That's a lot.
That's a lot. Worldwide, that's a lot, because that's over 5 million babies all over.
Every year.
Every year.
And so I was looking at that, and then I kind of revert back to the number now that you said the number here in Cayman. 60 plus.
Yes.
For an island of say 70,000 people.
That's rough. That's almost averaging.
That's
10%.
almost
averaging.
averaging
10% of one.
Right, exactly.
Yeah.
So I was like, wow, okay, so we're in that global standardization, and it's scary because I think if I'm a first-time parent or a second or third-time parent, and I hear that my child is a newborn premature baby, what's my first step going to be?
Well, that's the question most parents will ask. And that's where our pediatricians and our neonatologists come into play. So, usually the women would have had a relationship most of the time with their pediatrician before, before delivery. So, they ask, what's next? So the pediatrician will walk them through the journey of, you'll be at based on the gestation of the baby, what to expect. Here on Cayman, this is what we will be able to offer your baby while your baby is here. However, if your baby do need to be transferred overseas, these are our transfer overseas options in terms of service providers that they normally work with.
Right.
And then, any question the parents have throughout that process, they work with the pediatrician and sometimes us as nurses to help them answer those. We try our best to, answer and be truthful and factual about the expectations as best as possible.
Yeah, I mean, that would be a conversation that is not just scary, but also heart-wrenching.
It is scary.
So you want that conversation, whether you're in the government pediatric or you are in the private or you're neonatal. Managing the expectations of it is priority once you know that, this is a possibility. I would assume that you the registered nurses and all of that. What's the procedure from your side?
From our side?
Yes, from your side.
Okay, we are usually informed of an impending admission, preterm admission, by the obstetric team, either by the obstetrician or the midwives themselves. They would liaise with us, the nurses, as well as the pediatrician responsible for this woman. So once they tell us that this lady is here with us, she's X number of weeks pregnant and she is in active labor. So the pediatrician tells us, okay, obviously this baby will need admission.
Right.
So at the midwives then tell us how this baby will be delivered, whether this is going to be a normal delivery on labor ward or this is going to be a C-section baby that will need to go to theater for the delivery.
Right.
So once we know that, a pediatrician and a neonatal nurse goes to the delivery, and that's just to manage the baby at birth, because most of the times these babies will need some amount of respiratory support from the get-go, the minute they come out.
Right.
You don't know what condition they're coming out, so they will need stimulation. They will need sometimes resuscitation there at birth. So the pediatrician...
So you have everything just in case.
We have everything just in case. We have our warmer Heat is of paramount to these babies because once they get cold, it's all downhill from there. Okay. So we try as much as possible to keep these babies warm. We have our ventilators ready. We have our resuscitation, oxygen, and suction ready. We also do here at HSA, we give them a medicine to help with maturing the lung called surfactant. Okay. We do administer that as well to these preterm babies because
to help with the breathing.
Yes, to help their lungs mature because their lungs are premature, so it's very stiff. It won't go up and down as it should be. So when we give that medicine, it kind of breaks the surface tension and allows it to expand
movement
and help
from the inside. Okay. Yeah.
So we do a lot here at HSA.
It's a very complicated, and I'm just amazed by the fact that this can happen just shy of a few weeks from birth. So literally when you are 3 and 4 weeks out, there's still some issues that could be complicated there.
Yeah.
Wow. Over at the HSA, how many beds and stuff do you have available for? Because I'm assuming it may not be a case, but maybe you have 2 or 3 pregnancies at the same time. So tell me walk me through what is the premature care over in this, what is it, CIHSA?
Okay. So our neonatal unit at HSA has 6 beds, 6 designated beds for our NICU babies. Unfortunately, sometimes we do run over that. Like this week, we've been over that a bit.
Okay.
Yeah. So we have 6 beds. We have ventilators that we are able to manage care for baby. We have 3 ventilators. So if we have 3 babies need to be ventilated, not breathing on their own and need the ventilator, we have 3. So far, we've had 2 at a time, but not more than 2 so far since I've been here.
Of course, keep that in the prayers, right?
So we have CPAPs as well. So they may need support, but not. They can breathe on their own, but they need a little bit of support. So they don't really need the ventilator to do the breathing for them. So we step it down to CPAP. We have CPAPs that we use on these babies.
And for the public, you may just be tuning in. We're talking today with Nurse Angella about prematurity, the month awareness of it, which is November, and also Prematurity Awareness Day, which is November 17th. So when you say that, people take in mind, you may not know what CPAP is. That is a piece of breathing apparatus that you would put on your face. Now, mind you, I've seen adult ones. I did not know they had them for tiny babies.
Funny enough, our babies were first with CPAPs. You people came later.
I had no knowledge of that. I just remember, hearing and seeing it on TV and was like, oh, this is a thing now. Okay, you need CPAP, and they use it for adults for sleeping disorder. But now I know it for survival for our babies. Now I know that babies had it first. Yes. I had no knowledge of that.
So we give them their CPAP, which helps them to breathe. They usually need in the initial, I would say, depending on how young, maybe the first 5 days to a week, and then we step them down to high flow or low flow oxygen, where it's just basically oxygen, and then they progress from there.
Okay, understandable. Psychotherapists, OTs, all of that, they see the babies under when they're there and everything, checking for, I guess, for developmental
delays, how they're developing.
And we're able to do that here on Island?
Here on Island, we do have our physiotherapist who comes and sees our babies. Any baby born below 30 weeks is actually seen by the physiotherapist while they are on the unit, and she follows them home. So it's a journey that she starts with them in hospital, but she follows them home and monitor their developmental progress while they have been discharged and growing.
Okay, so it's even after the fact of birth and leaving the hospital.
Yes.
And that was one of the things I was, I haven't had a child in so many years, so all of this is kind of new to me. So for anyone out there who's listening, who's thinking about having a child, or maybe in term right now, please listen carefully, because this is information for you. So they follow them after their discharge and continue.
Yes. So they build this relationship with the parents once the baby is with us. So then they assess their movement, their tone, their activities. And basically, as the babies grow, they are looking to see if they're achieving their milestones, looking to see if they're doing what they're supposed to be doing at 3 months. Are they sitting up? Are they rolling over? As they get further on, are they crawling? How are they crawling? Are they crawling lopsided? Is there something there? So the physiotherapists are the ones who actually do that once they leave us. Mm-hmm. So while we may have them for the first couple of weeks or a couple of months, the physiotherapists have them for longer.
Right. They're there with them at the start and continue.
And continue with them even at home.
And that's good to know, because I would assume the expectation is scary when you don't know. So based on that, as I said, we talked about being the vision and the sight and those things of that, but the building process of the body at that point in time, you may not know what you're looking for.
But the professionals will guide you.
Professional one. It does. So that's one of the things that I definitely want my listeners to take in heed. A lot of people say, oh, we're out of the woods. No, you're not out of it, because there has to be a watch of the developmental stages of that baby.
Sometimes preterm babies have developmental delays. They're a little bit late. They take a little bit longer to reach their milestone than if a baby is born term. Mm-hmm. So the physiotherapist on the outside, along with the pediatrician, when they come in for their clinic appointments, they'll be doing their full assessment to see where they're at, if anything is going wrong or if everything is on track, and they will advise the parents as to what to do and where to go. Exactly.
Once again, if you're just tuning in, thank you so much. My name's Chuck Taylor, and I'm talking here with neonatal nurse Angella. We're talking about World Prematurity Awareness Month, which is the month of November, and World Prematurity Awareness Day, which is this coming 17th of the month. And one of the things that I want to talk about is, tell us a little bit about the initial care with the delivery of it. I know that, midwife, obstetrician team. Tell me a little bit about that.
Okay, so in terms of the delivery, once the baby comes out, we have what we call a resuscitator, a baby warmer. Mm-hmm. So the baby is moved onto there, and that's where we kind of, both the nurse and the physician does their initial assessment of this baby. So we look for the tone. Is the baby floppy? Is the baby vigorous and moving? Mm-hmm. Is it breathing? What's the breathing like? Is the heart beating? Because those are general things that we look at first. Is the heart beating?
Right.
How fast is the heart beating?
Right.
Because
rhythms and things of
that will
nature.
tell us, do we actually need to intervene? Do we actually need to resuscitate this baby? The breathing, the tone, and the heart rate. Those are the three key things we look for to tell us whether or not we need to resuscitate this baby and how much resuscitation this baby will need. Once we've gotten past that, it's ensuring the baby is kept warm. Once baby is breathing fine, kept warm, we move from the delivery area, whether it was in theater or on labor ward, we move the baby from there onto the NICU. And then onto the NICU now, they go back on another warmer or in an incubator, and we put on a full set of monitoring on this baby. So there we monitor their heart rate, their breathing, their oxygen saturation, which tells us a little bit of how well they're oxygenating.
Mm-hmm.
Nutrition. So if they need if they need lines, we put in lines. Usually it's through the belly button, which is an umbilical line. And that line we give our medicines. Most of the time we give them antibiotics down that line, or we give them what we call TPN, which is parenteral nutrition. So babies born early, one of the things we need to remember, babies born early, they will not feed. They can't suck and swallow. So we have to do the feed.
Okay. It's not... those parts of the body hasn't developed.
No.
Okay.
For the baby to feed by itself, baby needs to be able to do three things. They need to coordinate their sucking, their swallowing, and their breathing. So they can't be sucking, then forgetting to breathe, then forgetting to swallow. No, they have to be able to coordinate those three things. And we usually see that coming in around 35, 36 weeks properly. Okay. Earlier than that, we tend to put a tube down the nose, into the tummy, feed the baby.
Okay.
earlier babies, like your 25, 28 week, they can't get a good volume of milk because their tummy is still too small.
Right.
So, but what we then do is through that line in the belly button, the umbilical line, we give them nutrition, which is a kind of liquid nutrition.
Okay.
And that's tailored to the baby every
that's
day.
like a central access
Central
line.
access,
Okay.
yes.
And that allows you to monitor, give nutrition and medication for a couple of days until
we establish the milk feeding.
Okay. And that makes sense because the first couple of days, there's 24-hour care on this baby. It's a 24-hour watch based on everything that you told me. You know, you're checking the incubator, the radiated heat.
Yes,
all
or
of these
ventilators.
things require someone to be monitoring this child 24/7.
24/7. Usually it's the nurse.
Which, you know what? Honestly, there's a connection that goes with this. I mean, we're talking, and now I'm going to get to the emotional part of it because we got a couple of things that we're going to discuss here. But the connection that nurses and doctors have when this child is in this infancy and in need of help.
Yeah, I must say within HSA, we have a very good working relationship with our doctors, both those in the government HSA and the doctors we work in collaboration with from the private side. We have a very good relationship. So for these babies, trust is important because, as we said earlier, we are there 24/7. So we have to be the eyes and ears to be able to alert the doctor. They come in, they make their assessment. They have to trust us enough to understand the plan that they want to be put in place and follow their instructions as well. And if there's any reason we come up on something where we are not able to follow through with the plan that they have laid down, you know, it's a discussion between us and them.
Right.
You know, they come in and have another review, have another plan. So it's a tight-knit teamwork for us to get this, to get the care down pat. It has to be a really good team. And I must say we do have that at HSA.
That's one of the things I was just about to come to. I said, you know, if I'm a parent, I'm putting not just trust, but everything I have in the fact that you and every doctor and everyone in this building know what you're doing for the betterment of my child.
That's the scary part. You want to be in control as a parent because this is your child and you need to be able to do everything for your child. And we get that. And we do know that sometimes, you know, the stress from the parent is because they are not able to do it for their child. And we do understand that. So we try as a team to, you know, make them feel comfortable with us, feeling reassured in that we are able to care for their babies and we know what we're doing. Mm-hmm. So both from consultants, pediatricians, neonatologists to us.
And I think in this day and age, if I'm expecting parent, mother or father, and I hear you talk like this, the understanding that you're giving me, the passion that you're giving me, the professionalism that you are talking about makes me more at ease.
We hope it does. We fully understand that it's a very stressful time for parents, and we try as best as possible to make the journey as pleasurable. I mean, it will never be pleasurable, but the little moments that they have with their babies, you know, we try to make it good for the parents.
You know, because just as my child come out, I want to hold my child. I don't want to leave the side of that baby, that child. That is how every parent, you know, in going into a situation like this would feel.
That's the sad part. With a preterm baby, you may not get to hold your baby for the first couple of days because of all that's going on.
Right. And you know, the idea is that I don't want to leave the hospital. I don't want to sleep. I literally have watched people be dragged out of saying, come on, you need to rest. You can't help your baby by being sick. So you need to literally go home, rest, leave it in the hands of the professional, pray that they know what they're doing, because they do, and come back tomorrow.
So what we've done, as a neonatal unit, we have open visiting 24 hours. So the parents can just pop in and see their child at will. It was a little bit difficult with COVID restrictions, but now we've come out of that. We've lifted the restrictions a bit. So it's slightly different. We don't place a set visiting time on the parents anymore. They can come in even just for 5 minutes just to eyeball their baby, because some parents just want to eyeball, it's still there. And we give them that opportunity. We allow them to call us any time of the day. You're home 2 a.m. in the morning and you can't sleep and you want to check up on your baby, give us a call. Somebody's here to answer.
Let me backtrack a little bit. COVID. We're
oh God.
I know on the tail end of it, and still it's around, and it probably be around for the rest of our lives. But with that being said, how did you fare through that?
It was not so much of us how did we fare, it was how the parents fared. Because it was a very difficult time for them, because they were not able to, because in the initial onset, when we didn't know exactly what we were dealing with, most people went into total shutdown.
Yeah,
total shutdown. Yeah, once, no visits. And then later on, we allowed them a 15-minute visit per day.
Right.
So that was very tough for the parents. Can you imagine not being allowed to see your newborn baby? You don't know what's happening.
Right.
So that was tough for them. And I think on the back end of that, we got the backlashes, and we took that on, because that's part of knowing that it's just a frustration. This is not who these people really are.
Yes.
It's a frustration of not being able to be with their baby, see their baby, the mental effect it has. So that was tough. I wouldn't say it was tough for us, having to watch the parents go through it. But I can just imagine how tough it was for them.
Okay, understandable. We're talking today with Nurse Angella. She is from the neonatal unit over at the HSA. We're going to be back in just a few minutes. If you're just tuning in, we're talking about maturity here with our children, which is World Prematurity Awareness Day, which happens to be on November 17th, and World Prematurity Awareness Month, which is all the month of November. My name's Chuck Taylor. We'll be back in just a few minutes. We'll talk about some challenges that parents and family has when dealing with preterm baby. As you could hear, we just talked a little bit about the COVID. I'm going to try to put that aside for a little bit and talk about how we can prevent premature birth and what do the parents face with a preterm baby. Coming up in just a few minutes right here on Healthcare Today with the HSA.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health, because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
Thank you so much for tuning in. It's Healthcare Today with the HSA. I'm your host, Chuck Taylor, as we sit down and talk about an important month and an important day, folks. If you're just tuning in, we're talking about World Prematurity Awareness Day, which happens to be on November 17th of this month. And also this month is World Prematurity Awareness Month. And it deals with the babies, the youngest of the young, and preemies, as they say it. So I'm talking here with Nurse Angella from the neonatal unit. Some of the challenges that parents and families chase when it comes to this, financial. We've been talking about everything, and I was trying to save this till the end, but let's talk about the financial care of a preterm baby. Give me a little bit idea, a broad view of that.
It is expensive.
Wow, that's a pretty broad view of it.
I am not sure exactly of the rate here in Cayman, but I've worked previously in the UK, and for an intensive care day, just a day, it was £6,000.
6,000. Okay,
in perspective, yes, £6,000 per day.
Per day.
Yeah.
For a preterm baby.
Yeah. So
wow. And that's on information from insurance companies and all. So the treatment of that child requires a numerical value of approximately £6,000 in the UK.
Yes.
Wow.
So and here on Cayman, it's slightly different, and because your care here is based on an insurance thing. The sad thing is, and I don't know if I'm okay to say it here, is that one of the challenges we do find is for our preterm babies, if they have the need to be transferred abroad, is when we run into issues, because the parents' insurance may not be adequate enough to sustain that trip. And therein lies the problem.
And yes, it's okay to say that, because I think, as we said, always an honest and frank conversation. Maybe somebody's out there listening who knows a little bit more about this can help to look into and be like, we need to take a look at this, because this is happening. And mind you, we said the number before. We have 67 preterm babies. Out of that, 20 may be in that extremely delicate 24 to 28. Yeah, 24 to 28 week range. That requires more care than we can sustainably give here on
Cayman,
island.
Yeah.
We can start off the process, but it is literally too difficult to maintain it adequately.
Yes.
And that's the word that we want to use, adequately. For that family, for that young preterm baby. So when it comes down to finances, and just personal expense for parents, they may not be able to handle this. They may, the home, the work, the loan, the car loan, the payments, school fee, groceries.
And food for a new baby.
And food for a new
supplies,
baby.
diapers.
Supplies, that's a lot to consider. And even in an affluent country, because I consider Cayman to be very affluent, even in an affluent country such as us, it is difficult.
It is difficult. Some parents do have challenges financially. And I mean, some people are a little bit more conservative in, coming forward to say, I'm struggling. But when it does come to the forefront, when the baby needs to be repatriated overseas, to be sent overseas, because one, it's not just the cost of the health care that you're looking at. It's the parents' day-to-day living while they are in another country, which is not their home country, and there's that not family support.
Living out of a hotel is what I call it.
Yeah.
Even though you may have a family friend or a church friend, you're still not home. You're still not in a support. You're still don't know where to eat, where to travel, how to get things. It is difficult when you're living abroad, especially for emergency
care, intensive care.
Intensive care.
You're wondering, what is the bill going to be at the end of this? Will my insurance cover it at the end? Or will all my insurance be used up for this one child?
Wow. And that's heart-wrenching that you're talking about money when you have a sick newborn.
It's very difficult to talk about, because money sometimes is the last thing on the parent's mind. All they think is, my baby going to live?
Yes, you're faced with the hard reality of it does cost money to do these things, but then you're not in a mental place to have that conversation, because all you're thinking is, this is a life or death situation. How do I put a numerical value on that?
Yeah.
Scary, very scary. And that can affect not just the mom, the dad, but the kids.
I just want to say here is that traditionally I find we focus so much on mommy that sometimes we forget that daddy struggles as well. And I know the men want to be strong because they want to be strong for their partner. He can't fall apart because mom's already falling apart. So he has to be the strong one. He has to try and hold it together. But our men, they do struggle as well. And I just want to, shout out to the men who have held it together. But to say, brother to brother, look out for your brother, because he might not tell you that he's struggling, but you need to kind of look beyond, what you're seeing on the front.
There's, and it brings me back, of course, November is Movember Day, Men's Health and Men's Testicular Cancer and all these things. Emotional stress is a huge killer of people, whether you're male, whether you're female. Emotional stress at a time with a sick family member is bad enough. Emotional stress with a child, premature term child, is excruciating. Just think of it in those types of stress levels. Imagine now, on top of that, you're working and you're trying to get money, and your wife is overseas with a child.
And you're here with the other three.
And you're here with the other three, trying to make it work, trying to work to make money so you can pay insurance, to keep the insurance, to keep this go. Wow. It hurts my head talking about it right now.
Yeah. The men do a good job, but sometimes we don't give them enough, pat on the back.
Yeah.
And we don't give encouragement,
yes.
recognition.
Some love. Exactly.
Yeah.
Kudos to every male out there who has walked the path. And you know what? Support group, you have to do it. And I always say, as West Indian men and men in general, we don't reach out to others. We don't talk about family stress. We don't talk about home stress. Least of all kids. We're always first to say if they did something great, but when they're sick, we don't look for support in those areas, and that hurts.
I would just want to say, when it comes down to support, use the community resources that are available to you. Your church, schools, community centers, community groups, little groups. Use whatever is available. Ask questions. I know people are afraid of asking questions because I might not be asking the right thing. As I've always said to the parents on NICU, your question is yours. So you ask me. No question that you have is a stupid question. It's your question. You need to know.
Right.
I am the person who's supposed to provide you the answer. And if I can't provide you the answer, I will find somebody to provide you the answer. Right. Ask your question. No question is stupid in NICU.
Right.
So dads, moms, ask your questions.
Understandable.
We'll get you to where you need to go. We'll find the group for you.
That is a perfectly reasonable and understandable approach. Thank you so much. Nurse Angela, let me jump a little because we're getting short on time here. How can we prevent this? We've been talking about what happens after, all the things that happen when you find out you have a preterm baby, going through it, what happens after, and continue on. How can we prevent preterm birth? What are some of the things we can avoid, or what can we do to avoid?
So one, plan your pregnancies. Statistics shows that 18 months apart between your babies, that's a good time. 2, have a healthy nutrition with a variety of fruits, vegetables, and your supplements. Moms, don't forget your antenatal supplements. Please
folic
take your
acid.
Yes,
I know if you remember from my old days.
Yes. See your healthcare provider. They will advise you as well, and keep your regular checks up, especially if you have underlying conditions such as hypertension or diabetes or other comorbidity problems. Speak to your health provider. They will be able to guide you and keep you on regular checkups so these don't get out of hand, which may lead to a preterm baby.
Okay.
more commonly or not so commonly, alcohol, try and avoid alcohol and smoking and the use of illicit drugs. Because, some people do say they smoke a marijuana joint every now and again. Try not to. Or if you do illicit drugs, try not to, because those can predispose you to a preterm baby.
Okay, understandable. And as we raise awareness for the month of November, folks, here's some of the things that I know you can do. And I'll let Nurse Angela chime in there. Thank you so much for listening in today for the conversation. But pick up an information leaflet. If you know someone who is planning to have a child or someone who's in the process of pregnancy, pick up a leaflet to help them understand what we've been talking about here. This is critical. Information is key. Information is power. And information can help you make the right decisions, because that in itself is part of the process also. And I'll turn it over to Nurse Angela. What else can we do for the month of November? I mean, we're doing it throughout the year, but what can we do to help out with this?
So on the 17th of November, let me start by saying the entire month of November, Purple Mic here, is Purple Month, which means a Prematurity Month for awareness for prematurity. So that's the whole month of November. On the 17th specifically, that is our World Premature Day. So if you come on down to HSA, right at our atrium at the reception area, we'll be having a display, a NICU display set up there on the 17th from 11 a.m. to 2 p.m. You will be able to see a visual of what it looks like, or what your baby will be in the NICU. So we'll have our incubators there. Okay. We'll have our dolls dressed up as a baby. We'll have all our little things that we use on NICU there. So you can ask your questions there. We'll also have leaflets that you can take away and read afterwards. So that's 11 a.m. to 2 p.m. And nurses and doctors, depending on their schedule, will be on hand that you can ask your questions as well. Perfect.
And the good thing about it, folks, is, as she said, if you have a question, ask it. There is no silly or no I don't use the word dumb, but there are no questions like that. All it does is you need the information, and the professionals are there to provide it for you, and they will do so with the understanding that this is something that you will take to heart and use to better yourself and better the baby. Nurse Angela, thank you so much for stopping by here.
Thank you for having me.
And in closing, you said you were just new here, but you're not new here. You're family. When you guys already come back on, we can talk throughout the rest of this month, because the month is just kicking into gear. So remember, folks, on November 17th, over at the HSA in the main entrance from 11 till 2 p.m., from 11 a.m. till 2 p.m., they're going to be bringing out all of the, I say toys, but all of the, all of the
gadgets,
all of the working gadgets that they use to help keep your baby safe and sound. And also, if you're an expecting mom, stop by there, pick up one of the pamphlets, pick up the information leaflets, and they'll be having ribbons and pens and magnets and things like that for you to wear as for support for this whole month. And you know what? Be good to yourselves, Cayman. This is what I want for each and every one. And also be good to the ones coming up. Thank you so much for tuning in today. This is Healthcare Today with the HSA. I'm your host, Chuck Taylor, and I want to again thank Nurse Angela. It's been an informative conversation. You can always stop by the neonatal unit care and say hello to her if you're in the vicinity, because I know sometimes we have some folks always stopping by the hospital. We'll see you. The rebroadcast of this is on Saturday, so tune in for that right here on Bobo 89.1 FM.